Let's talk about pericarditis. It is the inflammation of pericardium. If the inflammation is acute in onset and the time duration of this onset is less than 6 weeks, then it is called acute pericarditis. But if it is in between 6 weeks to 6 months, then it is called subacute pericarditis. But if the duration of onset is more than 6 months, then it is called chronic pericarditis. Let's see various etiology of this pericarditis. Most commonly, the cause is idiopathic, but sometimes it may be due to viral etiology, then rheumatic etiology. A condition of heart called Dressler syndrome may also cause this acute pericarditis. In Dressler syndrome, the pericardium of the heart become inflamed due to immunological reaction after an attack of myocardial infarction. The origin may be due to malignancy also, and the most common malignancy that cause acute pericarditis is secondary oat cell cancer. In India, the most common cause is tuberculosis, and the other cause may be uremia, then radiation. Usually, those patients come to us with a complaint of chest pain, and this chest pain is radiated to left shoulder. This pain is relief on sitting and leaning forward, and its increase in coughing, then inspiration, then change in position. Chest pain due to acute pericarditis and acute myocardial infarction can be differentiated by last 2 points. Usually, pain due to acute myocardial infarction doesn't change with sitting up or leaning forward. Along with chest pain, the patient may also complain of fever, then malaise. Also, we may get pericardial friction rub and pericardial effusion. This pericardial effusion we may get or may not. If the pericardial effusion is more than enough, then it may also cause cardiac tamponade. This pericardial friction rub, it is a scratch-like sound, and it is felt in left sternal border if we press the diaphragm of the stethoscope at that area. Let's see the investigation part of this pericarditis. In blood examination, we may get increase in ESR, then C-reactive protein, then leukocyte count, which is non-specific in nature. This cardiac enzyme also may get raised if it is associated with myocarditis. In ECG, we may get concave elevation of ST wave. Like in this ECG, the ST wave is elevated in lead 1, then lead 2, lead 3, lead AVL, lead ABF, then V2, V3, V4, V5, V6, and ST depression in lead AVR. Along with ST elevation, there is depression of PR wave. Sometimes there may be sinus tachycardia also, along with ST elevation. There is also ST elevation in ST elevated MI, but the elevation of ST wave due to acute pericarditis is different from myocardial infarction. Here in acute pericarditis, the ST elevation is concave upward, but in MI it is convex upward, and this reciprocal changes is present in ST elevated MI but not in acute pericarditis. And in acute pericarditis, the ST elevation is diffuse or global, but in ST elevated MI, this ST elevation is present in specific area of the ECG only. And the big difference is PR segment depression is present in acute pericarditis, but it is absent in ST elevated MI. If this pericarditis is associated with pleural effusion, then in chest X-ray we will get enlarged cardiac border. But if the etiology is tuberculosis, then we will get water bottle appearance of chest X-ray. In echocardiography also we may get pericardial effusion. Sometimes if the diagnosis is uncertain, then we may perform the pericardiocentesis also to evaluate the case. Now let's see the treatment part of this pericarditis. If any patient present with us with an acute attack of pericarditis, then we may prescribe him aspirin. It is given 4 hourly. If aspirin is not available, then we may also give ibuprofen. If the patient is young, then along with aspirin, we may also give him indomethacin. This indomethacin it doesn't give in old patient because the risk of myocardial infarction. If the acute attack of this pericarditis is not due to viral etiology, then we may also prescribe him corticosteroid. The definite treatment of this pericarditis will be treatment of the underlying cause. In viral etiology, we can give antiviral drug. In rheumatic etiology, we can give anti-rheumatic drug. In tuberculosis, we can give anti-tubercular treatment. And in uremia, we can treat the underlying cause.